Every day in the NHS maternity and neonatal services, staff are working really hard, bringing their wide-ranging skills together to make sure that premature babies can get the best possible start in life. So in this short film, we're going to follow one couple's preterm birth experience, and we're also going to meet some of the healthcare professionals who've worked together to make sure that they and their tiny baby got the right care in the right place at the right time.
I felt some pains. It was about 1 o'clock in the morning on a Wednesday, and I thought it's probably nothing, just a little bit of pain. At that point, I was 23 weeks pregnant.
Plus 6.
23 plus 6. And yeah, they sort of like progressively were getting worse, but again, didn't really think too much. For context, in terms of pain, I'd had a herniated disc in my first trimester, so that pain was off the scale, whereas this was sort of more like a niggle. But as it kept coming, the pain became a bit more frequent. I thought we should probably either call an ambulance or head to hospital. So we called ahead to our local hospital, and they said just come in. What we didn't do was pack a bag, because we thought we'd just be in and out, so always pack a bag. And yeah, we sort of turned up, I was examined, and they were like, oh, you're actually 6 centimetres dilated. You're in labour.
She's coming.
It's difficult to deliver that information in a way that anyone can process it, because you're going to a situation that's completely unexpected. Whereas if your term and you're in labour, you can probably deal with information a little bit better because you're prepared for that. It was just a Wednesday night.
Yeah, we had 4 months left,
4 months.
So we weren't planning to even head out that night.
These are a very, very high risk group of babies. And for this particular group of babies, there are small marginal gains. Multiple small interventions make a huge difference to their outcome. And so that's why we have centralised the intensive care, and we know that that has improved outcomes, and that's been proven both in this country but also in countries around the world, that if you centralise, you will get better outcomes.
We were given a lot of information about her chance of survival, any complications if she did survive, including disability later down the line. At that point, I was given that information. I also received my first steroid injection to help her lungs, and then my first magnesium sulfate injection to protect her brain.
We know that if we give mothers a large dose of steroids in 7 days before the baby's born, that improves the outlook for the baby. But beyond 7 days, it doesn't seem to make very much difference, and repeating that dose of steroids is not helpful. So you've got to time and estimate when a baby's going to be born very preterm can be very difficult. So timing those steroids is very tricky. Magnesium is a drug that, if given shortly before a very preterm birth, will also have very significant beneficial effects for a baby. Again, you've got to time that right. And there's been a very effective national program improving the rate of magnesium administration before very preterm babies.
It's one thing to be in labour, to then have to deal with thinking about what medical care your unborn baby needs if they even survive is incredibly intense. Do we stay here? Do we not stay here? Because we knew we'd have to eventually go to a level 3, but we didn't know when. And then the question was, well, what's the difference between those hospitals? What facilities do you have? What specialisms do you have?
We're really lucky in that we have a really robust intrauterine transfer guideline that we share collectively across our region. So it means that really robust conversations happen between both of those units. It means that the optimisation of that baby starts from the very moment the woman arrives in the level 2 unit. So for Rebecca's case, for example, she already had her first dose of steroids, magnesium sulfate. She was started on antibiotics even prior to that transfer happening. So it really was a seamless process for her.
The ambulance is here. Do you want to go? We have a team ready to go with you. If you deliver in the ambulance, you have a specialist with you, so that's covered. And we'll blue light you the whole way. I think we just said, yeah. let's go. Like,
It
if
was
it's
just
good
made
to go,
very
let's go.
clear that it was the
It
best
was the-
place for us to be for delivery, and that little ones at a certain gestation don't travel too well in ambulances, so she really needed to come in the right place.
Clinicians need to be brave, and parents need to be brave about trying to transfer these babies. Now, the course of preterm birth is very, very unpredictable, so it's quite unlike term birth. Actually giving birth in the ambulance is really, really rare, and the overall net benefit is that you get very much better outcomes, even if you transfer people in late labour.
And the transfer was completely seamless. I was in the ambulance with a midwife and a specialist, a neonatal specialist.
We did blue light her there just because of the risk of that she might deliver in the ambulance, and we had all of the equipment ready if that was to happen. So if she was to deliver, we had equipment there to be able to keep Luna warm. We had equipment to be able to stabilise her, to be able to maintain her airway, maintain her breathing, and we made sure that that transfer was as safe as it can be.
At the time of birth, there are also further interventions that can be done. For example, optimising when you clamp the cord and delaying that until the baby's starting to take breaths and establish breathing is really the best way to do that.
I actually asked the question about delayed cord clamping because that's what I wanted to do, even if she had arrived on time, and I think she had the maximum amount of time before they needed to then give her support with her breathing.
We need to control the temperature of the baby, and whilst that might seem a very easy thing to do, these babies are very small, very thin and very wet. And it can be very, very difficult to hold the temperature at the right level. So we put them in plastic bags, we have them under heaters and warmers, and we tend to try and make sure that we maintain their temperature very, very accurately to stop them becoming cold, because again, we know that that increases their likelihood of not surviving.
The one thing that couldn't happen, which I think probably happens with most births after a certain point, is I couldn't pick her up and hold her right away. I was told I just had to leave her be, which was quite difficult. But I saw how small she was and I completely understood the situation. So once she arrived,
Kicking and screaming.
she was kicking and
She
screaming.
wasn't unresponsive.
No, she was very angry actually
Yeah,
when she
yeah.
arrived. Alan got to cut the cord as well, which was, we didn't think we would be able to have that opportunity, so that was really lovely. And then she was whisked away, and we were told that, well, they explained the plastic bag to keep her warm. I'm not sure a better way
And the
that
tin
they
foil.
could tell you, but yeah, so she was put in the warm bag, and then she was wrapped in tin foil and bubble wrap and all that kind of stuff, so that we could actually have a cuddle, which we weren't expecting. So we do have a picture of us, well, me holding her
Little newborn.
as a tiny, tiny, tiny baby. So that was something, again, we didn't expect, but it got to happen. I mean, I couldn't have asked for anything better given the situation. I was expecting the worst case scenario would be that she's just taken immediately and gone up to NICU, but actually we got to have the delayed cord clamping. Alan got to cut the cord, we got to have a cuddle, and that was really lovely.
Luna being born at 24 weeks is very much at the limits of prematurity that we're able to support, and every little thing that you can do to help them to survive sort of mounts up to help them with that. Sadly, it's not always possible, but I think in Luna's case, everything went very well, and she came through our neonatal unit with very few complications, which was really important.